Welcome back. Healthcare is a complex system, much like an ecosystem. It contains many organizations that are codependent upon one another for the role they play, much like a biological ecosystem. Consider a pond. There are many organisms that interact in order to maintain the balance of the system. Water, plants, and fish are all codependent upon each other for their survival. In the healthcare ecosystem, there are entities such as hospitals, doctors, pharmaceutical companies, employers, insurance companies, government like Medicare and Medicaid, and government regulators, as well as technological developments that impact the ecosystem in many different ways. All of these organizations play a key role in the ecosystem and may impact the way we interact because of all the healthcare changes that are taking place. Let's take a deeper dive into some of these organizations. Hospitals and physicians provide a wide range of treatment and services, and many use drugs that are developed by pharmaceuticals for that treatment. Employers use insurance companies to pay for the doctors and hospitals to provide care. Employers determine how the insurance company defines the benefits that the consumers receive. Insurance companies negotiate with the doctors and hospitals to determine payment for the services they provide. Government programs like Medicare and Medicaid may also provide payment to doctors and hospitals, as well as regulations that they have to follow. Every member of the healthcare ecosystem is attempting to control their best interest. How that occurs is dependent on the marketplace in which they operate. The ecosystem is always changing, just like the biological ecosystem. Consumers are stuck in the middle of the ecosystem with no player completely focusing on their needs. Additionally, there are technologies that further impact the complexity for the consumer. These new technological changes include remote monitoring devices, new analytical tools that help us identify high-risk patients, new phone apps that allow us to access our medical records and even make appointments, and new ways of accessing care, such as video technology, where you can interact directly with the physician. If a new species is introduced into the relatively balanced biological ecosystem, it throws the entire ecosystem off balance. The result is some species may not survive, but other species may thrive in this new system. One cannot easily predict the impact the new species will have on the ecosystem. There are many similar factors that are constantly changing the balance of our healthcare and impact their payment models. Issues such as new payment models that reimburse some of these organizations differently. There may be new employee benefit designs. Some of you may have experience with these high deductible plans. There may be new regulations, such as the Affordable Care Act, that significantly change the way care was delivered and how people access care. And certainly new competitors may enter the ecosystem and can cause disruption. These influences can often alter the way the players react. Some may seek new partners in that ecosystem to align their interest. Some may also acquire new companies and sometimes acquire competitors in order to strengthen their position. Some may merge with affiliated or established partnerships. But all of this is being done in order to maintain and protect their role and their interest in ensuring minimal disruption to the role in the ecosystem. And even more complex influences is when a new and more powerful entrant, such as Amazon, enters that system. There is then even more potential for greater change and confusion, not just for the members in the ecosystem, but for us, the consumers. Our different roles as consumers may impact or change the way these organizations interact with the ecosystems. Sometimes we act as an employee of a company that offers different health insurance. Sometimes we are the consumers of healthcare, and sometimes we may also be a patient. Sometimes we are an advocate for a family member. And lastly, we may be an employee of one of these organizations in that healthcare ecosystem. We, no matter what role we play, are continuously being impacted by both the volume of these changes and the increasing speed and rapidity in which these changes take place. However, all of this chaos offers us an opportunity as consumers to exert a greater and greater role in controlling these changes and minimizing the negative aspects of these changes. This is what we will discuss throughout the remaining modules of the course. Next, we will review an example of how consumers can control and do control an ecosystem.